Welcome, Your Excellency. This is our laboratory. It's a level 5 laboratory. We have young ladies working here. She's called Yvonne, the lab manager. Services of our consultants and our patients. Thank you. Our psychology team works with them to support them in the play. Again, we have a dance therapy hall. However, to take it up, COVID hit, and they've had some challenges. To just celebrate the Tufumboke initiative. Psychologists and junior psychiatrists. Your Excellency, welcome. This is how it is set out. Station. Then on the shared floors, we have a common area for our clients. This is part of the...
It's with pleasure that I join you in commemorating the 25th anniversary of Chiromo Hospital Group and to open the new mental health facility, the Bustani Level 5 Hospital. I'm very pleased to be here amongst people who have shown extraordinary commitment and provided invaluable contribution in accelerating interventions around mental health and mental wellness. I recognize the extraordinary talent and collaborative partnerships of consultants, advocates, ambassadors. Thank you for stepping up efforts to support people struggling with mental health and raising the focus on this issue. Mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act. It also helps determine how we handle stress, how we relate to others, and how we make life choices. It's very important at every stage of life, from childhood to adolescence through to adulthood. I congratulate the Chiromo Hospital community for your commitment, investment, and dedication to raise awareness on this very important issue. Your vision, tenacity, and impact of your work is evident from what I've witnessed in my tour of this facility. This purpose-built Level 5 facility has indeed set new standards of mental health service delivery for the region. I appreciate the fact that you have gathered all of us here, including of those watching on TV, to advance the conversation on mental health and to hear from people who have shown extraordinary commitment and courage to address the issue. The chronic nature of mental health and the rapid increase in the numbers of individuals affected by mental illness has highlighted focus on mental wellness the world over, especially during these unprecedented COVID times. In the conversation today, we have learned some important facts about these illnesses that we probably didn't know 25 years ago when this institution first started. At that time, we did not have enough evidence to back up what we needed to know or how we should proceed with treatment for many of the problems we saw. But today, we know a lot more. We can now use this knowledge to implement better policies, implement better treatment modalities, and scale up interventions that will support a reliable mental care system. In this regard, the government has made significant strides through its collaborative work with the mental health community, supported by focus on this issue by His Excellency, the President, in promoting interventions around mental health through the Kenya Mental Health Action Plan 2021. We have made progress in learning about mental disease in the last few years so that we understand them more scientifically. These include anxiety, personality disorders, mood and substance abuse disorders, trauma-related disorders such as post-traumatic stress disorder, and psychotic conditions such as schizophrenia. We now have a better idea of what to do about them. These gains have been impacted by the recent rapid increase, especially during COVID-19 pandemic, that has presented devastating impacts to many individuals, families, and communities. We know that the numbers are growing. We have witnessed unfortunate incidences of suicide, substance abuse, and addiction among some of the social challenges facing our society today. These are made worse by discrimination and isolation of people suffering from mental illness. We all know of or have heard of someone who has battled with mental illness. This is a signal to our nation that we must do whatever it takes to heighten our efforts to create awareness about mental illness. In many ways, despite our efforts, we lag behind in our mental health intervention efforts because we were not really dedicating enough resources towards the scientific research in this field, especially that of mental health for children and the warning signs from adolescents and young adults. I call on all of us here and around Kenya to make more of an effort to increase our understanding. Our focus, our obligation and responsibility must be to draw attention to things we have ignored in the past and to begin treating mental illness as an illness at a parity with other illnesses. It can be treated, and we know many who have recovered enough to lead a healthy life. Yet too many individuals are being left to deal with these issues on their own, and many face complicating life circumstances like drug and alcohol addiction, confinement, or abandonment. We must not accept this. We must do a better job. Access to quality mental health treatment, appropriate medical and psychological support where patients are treated with love and dignity is crucial to patient recovery. However, we cannot leave mental health care solutions to science and laboratories alone. We need to be aware of the cost of untreated mental illness, the loss of school days, loss of work days, dropout, marital distress, and also lost opportunity cost, the economic effects of individuals who are not functioning at full capacity. We must improve how we speak to our children about mental illness and talk specifically about their needs. I applaud the efforts of schools and community groups who have decided to join in and speak out. Our efforts are impeded by our own individual biases, myths, and beliefs, all perpetuated by ignorance and stigma. Our biases have not helped to encourage individuals seek treatment. In fact, these reactions silence patients suffering from mental illness from speaking out. It has demoralized families who have ultimately had to take care of their loved ones on their own. As individuals, parents, role models, let us ask ourselves what steps we can take to demystify mental illness. What must we do to guard against stigma and discrimination, which is deeply entrenched in our society? One of the ways we can change the misguided perceptions is through more public awareness. I know that heightened advocacy and awareness works through my own work in Beyond Zero by highlighting maternal and child health. We also have many great examples of how advocacy works through joint collaboration through the media with community support. Today, I commit to add my voice to raise awareness about mental health and to support the global collaborative campaign, Tufunguke, to encourage the voices that are silent to speak up and be heard. We can do this together. Thank you, and God bless you all.
I am delighted to join you today in celebrating the 25th anniversary of Chiromo Health Group. Through the story of Chiromo Health Group, I see a story of medical care in Nairobi County and in Kenya that has evolved from a small mental health facility to a modern, sophisticated health facilities that continue to offer dignified and quality health care, not only in Kenya, but in Africa, with highly qualified psychiatrists, psychologists, addiction counselors, occupational therapists, and nurses working together to promote all-round quality mental health care for patients in a dignified manner and environment. And congratulations, where we are sitting today, you can see what Chiromo Health Group of partners are doing. So I want to urge the management and mental health specialists in this hospital to offer mental health education and facilitation now more than ever because of the current COVID-19 pandemic, which continues to affect us in our homes and in our workplaces. Nairobi residents and Kenyans in general continue to suffer in silence because of the stigma around mental health. Your Excellency, the First Lady, I'm reassured with your presence here today to mark this special milestone achieved by Chiromo Hospital Group. It is a time we come out and speak freely about our mental illnesses and its effects in our husbands, our wives, our colleagues, our sons and daughters, and our colleagues. Let us all come together and fight this stigma and strive to prevent mental illness, as well as manage it when it occurs, as we ensure our loved ones recover in dignity. Dozens of people with mental health conditions in Kenya are deprived of their human rights. They are not only discriminated against stigmatization and marginalization, but also subject to emotional and physical abuse in both mental health facilities in the community. In the past, poor quality care due to lack of qualified health professionals and dilapidated facilities led to further violations. I want to recognize the efforts of both the national and county governments in their efforts to ensure the mental health services are mainstreamed within the general health system and accessible within the communities. The domestic legislative framework needs to respect the inherent dignity of persons with mental disabilities respect their legal capacity, including the right to free and informed consent to treatment, inclusion and decision-making processes, and public information campaigns. There is a need to ensure that when crisis events occur, part of the humanitarian response is appropriate and timely mental health support. To the group management and staff of Chiromo Hospital, you have a huge mission, a mission to ensure patients in your care continue to receive world-class medical care and high treatment standards maintained. Once again, congratulations on your successful journey for the past 25 years. I wish Chiromo Hospital Group specialty to continue its successful journey.
As it now, and through the leadership of the government, through the relevant regulatory authorities, we have the first level 5 mental health care facility in sub-Saharan Africa, Your Excellency. This brand hosts of 180 beds. And Your Excellency, I can assure you, every day we offer an average of 100, minimum of 100 inpatient care. Today, as we are standing here, we have at least 100 Kenyans and other members of this world receiving quality psychiatric care. This particular brand is key on partnerships. Our number one partner are our staff members. Today, we have 212 staff members who provide that dignified, quality mental health care. They are led by psychiatrists. The KMPDC chair, who licenses doctors like me, Your Excellency, will tell you that in that list today, licensed practicing psychiatrists are very few. Of the 55 million Kenyans that you lead, Your Excellency, there are about 75 actively practicing psychiatrists. That ratio, we are sure that working with the Ministry of Health will continue to enhance that number to provide dignified quality mental health care. Our 38 partner psychiatrists lead the teams in admitting and providing that quality care within our brand. We have 52 clinical psychologists. Clinical psychologists, Your Excellency, we know an individual goes out for 2 weeks HIV counseling training and they become psychologists. The following day, they put a big brand on the door, they are psychologists. No, here, Your Excellency, we have qualified clinical psychologists. These clinical psychologists working with other professional team members every day work to exceed the expectations of those who choose to walk through our doors. Mental health care. The World Health Organization says that it is the ability to give an individual optimal wellness, optimal opportunity to enjoy their life, to deliver in the economic development in the best way they can. Mental illness negates that. The space in which we operate, Your Excellency, is an emerging epidemic. The Global Mental Health Action Plan, the Kenya Health Policy, the Kenya Mental Health Action Plan 2021-2025 clearly highlights that this is an emerging epidemic. When COVID hit, the gains, the fragile gains, as I would call them, Your Excellency, in this field were either halted, disrupted, or totally disappeared. These gains on the mental health care landscape with the coming of COVID impaired access to quality mental health care. Many would not access quality mental health care that the actors were pushing towards the same. this brand, under the leadership of the presidential advisor and the other directors, worked with the government to position and continue to provide that care. 300 million people, of the 7.9 billion people inhabiting Earth, 14% are estimated to have mental health care needs. The 1.1 billion people trickle down to Kenya. When the President, His Excellency, formed the task force on mental health to just understand the magnitude of this problem, we were honored that it was chaired by our chair. They said that 25% of those who seek outpatient care have mental health care needs. 40% of those who are admitted require mental health care needs. Are they aware? Are they receiving that care? No. Up to 75 to 80% are not aware that they have mental health care needs. It is an emerging epidemic. The resources that are dedicated for this emerging epidemic are not consistent with the magnitude of the problem. The World Health Assembly in 2018, October, 10th of October, provides a declaration and expands the NCD to the 5x5. The non-communicable diseases that were initially 4 were expanded to include mental and neurological diseases. So mental health, mental illness is one of the non-communicable diseases, Your Excellency. The progress we've made in cancer, diabetes, hypertension, chronic respiratory illnesses, is it the same pace at which mental health care is provided? There's a lag. And we are here in line with the global Sustainable Development Goals, saying that it is possible to provide dignified, quality mental health care. The resources, that there is need to escalate, mobilize and allocate more resources to this emerging epidemic. The resources have to be adequate, consistent with the magnitude of the problem. The resources have to be predictable, that it is not a hazard, that from the ministry, the relevant ministry, given that this is part of the tripod of the global agenda, it is predictably allocated. And it has to be sustained. So the resources that are channeled towards the mental health care space have to be within those domains. In Kenya, and we are very happy to report that this government has worked tirelessly to allocate increasing resources to the Ministry of Health. We are very happy about that. The Jubilee agenda was to allocate 12% of the budget to the Ministry of Health. 2 years ago, we hit 9.5%, just shy of the 12% that was set in the policy. We are working towards that as private healthcare practitioners, private healthcare actors. And Chiromo Hospital Group, leading in sub-Saharan Africa, that initiative is partnering very closely with the government to close that gap and provide dignified, quality mental health care. The NHIF, the private insurance companies that are here today, individual foundations, people who come out to just channel these resources are working actively towards enhancing the required need to provide the resources towards this emerging epidemic. Your Excellency, as an NCD, mental illness is preventable. The determinants, the socio-economic determinants, risk factors that predispose individuals developing mental illnesses can also be addressed at their root causes. And as Chiromo Hospital Group, we believe, in line with the WHO, that there is no health without mental health. That mental health comes first. And we will work with all the partners to be able to protect the mental wellness of Kenyans and beyond, to promote the mental wellness of Kenyans and beyond, and, if required, to provide the restorative mental health care services. That can only be possible with this collaborative team. Your Excellency, this is just but a representation of those who we work with in this space to provide that needed care. We have the insurance companies here, we have the government regulatory authorities, and many more working here. To change this narrative and work in line with the Mental Health Care Action Plan 2021-2025, leadership and governance, preventive promotive mental health care, access to quality mental health care, the infrastructural needs for mental health care will be done here. The leadership and governance, Your Excellency, we are highly humbled as the mental health care actors that you are leading us today. The whole world is watching. That the leadership is starting right at the top, adding your voice. The initiatives, Your Excellency, you've undertaken save lives. And we believe as mental health care actors today that your voice that you are adding to this space will save many more lives. It is my humble duty, Your Excellency, as we proceed with the program, that we will get to learn more, that this narrative can only be changed through lived experiences, as we invite many more to open up and not suffer in silence.
Pleasure to be here today and to congratulate Chiromo Hospital Group as they mark the 25th anniversary and the development of a modern mental health facility. This is a great milestone in the efforts of improving access towards mental health services in Kenya. Ladies and gentlemen, mental health conditions contribute to an enormous burden of disease, disability, and mortality. And I wish to share with you some statistics which demonstrate the mental health status in Kenya and globally, and the urgent need, therefore, to invest in this space. To begin with, the projected prevalence rate of mental health condition stands at 10 to 15% of the global population, and a vast majority suffer from depression. In other words, we are estimating that 350 million people are affected globally. And in Kenya, mental illnesses are a significant cause of ill health, with an estimated 25% of outpatients and up to 40% of inpatients health facility visits have diagnosable mental health conditions. And when we speak of 25% of outpatient visits, in Kenya every year we have 64 million visits to an outpatient center. So you can calculate 25% of that. That's a huge burden. The country has also witnessed an unprecedented rate of suicide, with an estimated age-standardized suicide mortality rate of 5.6 per 100,000. And I'm sure you all saw the story last week that was featuring about 468 cases of suicide in the last 3 months, compared to about 300 in 2019. And so these numbers are staggering, and therefore we need to do something about it. In terms of economics, when we measure the burden of this disease, we've come to learn that the global burden of disease, measured in terms of disability-adjusted life years, and 33% of years lived with disability are attributable to mental, neurological, and substance use disorders. And therefore, Your Excellency, ladies and gentlemen, despite the high disease burden due to mental health conditions, majority of people do not access services due to various reasons, including that these services are not available in their communities, that the services are not affordable, that we lack adequate resources and systems in terms of providing comprehensive quality care services, including also investing in human resources, medical products, and commodities. And so to address these challenges, we have to recognize the role of concerted efforts, and that is why we're here today, Your Excellency, partnering with the private sector, Chiromo Hospital Group, the regulator, the Ministry of Health, represented here by our Director of Mental Health Services, and NHIF. All these are partners coming together to ensure that we are able to provide this service. And in recognition of this, Your Excellency, allow me to appreciate your efforts, particularly in the Beyond Zero campaign that you've really mounted and been a champion of. And perhaps this is a discussion that then Connie and I need to have when it comes to integrating mental health services in that service. We do know mothers, particularly post-delivery, do suffer from different kinds of mental health conditions and issues when it comes to depression and psychosis. And now that the Ministry of Health has put in place psychologists in all the 47 counties, then this is an initiative where we can actually integrate this service into the mobile clinics. And so this is something that we need to discuss, along with adolescent health and geriatric care. And so currently in Kenya, we are experiencing an increase in demand for mental health services. And the prevailing situation that has led to this demand is what we're doing here today, celebrating groups such as Chiromo who've put in place resources, talent, expertise in raising public awareness, in reducing stigma when it comes to mental health diseases, and in ensuring that we're able to change the trends of mental health conditions. As a Ministry of Health, we do remain committed in implementing various policies and strategies to transform mental health services in Kenya. And to begin with, we do have the implementation of the task force report put together by His Excellency Uhuru Kenyatta. We do now have a mental health action plan, 2021 to 2025, and it highlights various priority pillars where we will be putting in place investments. And perhaps the one that excites us the most is that in the coming few months to years, we shall be moving Mathare Hospital from its location all the way down to Karengong area, in an area that's pristine, that allows for light, for green spaces, and for more recovery and, recovery in dignity. Perhaps we'll borrow your logo there, if you allow us. And really, this is a step towards increasing resourcing of the mental health space in Kenya. As I conclude my remarks, I wish to state that the public and private partnership in mental health will be a key driver to the achievement of the set targets in our plan to ensure that Kenyans achieve the highest attainable standards of mental health care. There are various opportunities and synergies that we need to explore, and we do celebrate the Chiromo Hospital Group for putting this in place and ensuring that recovery occurs in a space of dignity.
It's being presented to Her Excellency the First Lady. Can you all of you hold it to the cameras? 25th anniversary.